Let's still stick on health because there's an increase in demand for an urgent government intervention to provide holistic care for mentally ill. Attempts by non-governmental organizations to complement government's efforts have been overstretched due to the immense need for human and financial resources. Reducing stigma and ensuring access to quality mental health care in Ghana remains a mission yet to be accomplished. Hannah Odame has been exploring the case of mental health care in this feature titled Minds on the Street.
Sometimes I feel very bad because some are very young and some are very old too, and some too they are not clothing well, so sometimes you feel bad about it.
It is not only about how they feel, but the pain they can also inflict on anyone they come by.
In August 2022, a mentally challenged woman hit a man with stones at this particular spot. For those who stay and live around, it was a moment of reawakening. For how long are they going to tolerate or look over their shoulders when they see a mentally challenged person in their vicinity?
That torturous incident lingers on the minds of many who heard it, but most especially on the minds of those who witnessed that horrific act. The thought of being attacked, abused, or beaten by a mentally challenged person is an act no one would want to experience.
It's quite frustrating of late. I do meet them. Sometimes they come towards you whilst you are working, and you are a little scared, especially during the night, and you feel you should run away. And when you try to, they try to follow you. It is something which is really, uncomfortable. And I feel the government should, in a way, try to put them together in one place. Some are very threats to life.
That intervention to get them off the streets was announced on March 2022 by the then medical director of the Accra Psychiatric Hospital, Dr. Pinaman Apau. She revealed the redevelopment of the facility into a 220-bed hospital was under government's Agenda 111 program and was part of many other projects, including the construction of 101 district hospitals, 6 regional hospitals, and 2 psychiatric hospitals.
The first date that was communicated to management was the end of June 2022. However, updates that I got recently from the coordinator of the Agenda 111 project indicates that currently they are doing what we call technical evaluation on tenders that had been submitted.
But almost a year on, not much has happened in terms of a pull-down and a facelift. One would think the facility hosting some of the mentally challenged persons in the national capital will be rid of their presence around their premises. But that's not what we see here at the Accra Psychiatric Hospital, with some of them reserving permanent habitations around this place. Passers-by and residents are uncomfortable.
We will feel very bad because it is not good for somebody to carry a stone and throw another person. Even the person is not a madman or the person is not a mad woman. You understand? We call it a little violence. It's something that is not good at all.
Former director of the Accra Psychiatric Hospital, Dr. Akwesi Osei, delves in on this development.
As at the time the idea came to pull down the structures and build new ones, we had got to the point where it didn't seem fitting for a facility of our age in Ghana. So the idea was to pull it down and rebuild it. All things were more or less in place, but somehow it stalled. I'm sure it's not totally dead. I'm sure the plans are still there, that somewhere along the line, you'll get the funding to continue the program. That was it. Now, you mentioned two new psychiatric hospitals. Yes, one in the northern belt, one in the middle belt. As far as I know, they are still on the drawing board. Land has been secured, and they started building them. So we hope that funds will continue to be available for them to finish building them. And if they finish, it will be wonderful. Because for now, all our 3 facilities are down south.
As the nation waits to see the fulfillment of the redevelopment promise, we should have seen the completion of the redevelopment promise. The mentally challenged on the streets will perhaps remain, and the fears of many will also perhaps remain.
Some of them, in fact, they look scary, and I think it is not right to be walking on the way and maybe coincidentally you run through them, and then some of them, in fact, what they can do to you. And because he's a mad person or mentally challenged person, you can't take him or her to court or anything like that.
I am Hannah Odami for Joy News.
And back in the studio, my name is Aisha Ibrahim. I've been joined in the studio by Dr. Yao Amankwa Asa. He is the Deputy Director in charge of health promotion at the Mental Health Authority, and we're going to have a conversation on this. First, let's look at key strategies and considerations as far as mental health care is concerned in Ghana.
Okay. First and foremost, let me say a good morning to your cherished viewers. This report that you just shown is a concerning issue. It's indeed a concerning issue. I mean, when you walk the streets of the major capital towns in our country, you find lots of them, and it's quite worrying. But we need to do something about it. We need to do something about it. It's becoming a security threat. So if you ask about the strategies that we are using to dealing with this situation, I mean, our current Mental Health Act asks us to move away from institutionalization to community-based care, whereby persons with mental health conditions would have more of their management and treatment in the community.
Okay.
So that being said, what it means is that we need to integrate mental health care as part of the primary health care, having personnel to be there to be part of the management. We have community mental health nurses who will go into the community to look after these persons, include their caregivers, family members, all part of the care for persons with mental health conditions.
What's the status of interventions, if I may ask? I mean, to check stigmatization of persons with mental health. Over the period, we've had cause to complain about this.
Well, stigma is an attitudinal problem that is more rife in our community. It's a deep-rooted problem. Stigma is about when you know. So let me set the story this way.
Okay.
If I should ask you that if you were to, or somebody close to you, a colleague, is experiencing psychological issues, what is your knowledge? Do you have appropriate knowledge? Do you have good attitude to support this individual to seek for care? Would you support that individual while that person is receiving care? That is the question asked.
Okay.
If the answer is yes, fine. If the answer is no, then there's a bit of stigma there. Because you see the person and you think that, oh, you have your own problem, you have personality weakness and all that. That is the issue that we are having. So yes, stigma is not something that we can assess. It's by our attitude towards our colleagues, our family members and all that. Imagine somebody breaks the hand. All of you guys will go to visit that individual in the home.
Yeah.
But what if I say that I have psychological issues? You have your own problem. You have personality weakness. That is the stigma. So it's about time, and it's underpinned by lack of knowledge.
Yeah.
So until people get that appropriate knowledge, they will still express negative attitudes.
And then that's where I'm heading towards. Have you created enough awareness? Because if I have a colleague or I have someone closer who is showing some traits of mental illness, I may not even know because I don't know the symptoms, I don't know the triggers, I don't know what to look out for. But if I'm educated well enough, then I'll be able to pick some of these signals and not to stigmatize.
Yeah, that is very true. And with this awareness, it comes in different forms. We can do a whole nation whereby we'll show stuff on TV, on radio, and of course, you yourself will need to take that step to acquire that knowledge. When COVID came, we were not waiting for the TV. We were reading all over the place to get knowledge about it because it was scary. So it is the attitude with which we embraced acquiring the knowledge of COVID. Same way we should do with mental illness. Because look, I mean, for the statistics tell us that for every 4 people, 1 of them is likely to experience mental health conditions in their lifetime. Okay. And currently we have more than 350 million people globally experiencing depression. And the current dispensation is full of stress. Yeah. Work-life balances, relationship issues, the Ghanaian environment itself, traffic, religiosity, family issues, socialization and all that. All this is causing so much stress for us. Yeah. And stress, if you do not take care of it, would graduate into the psychological issues. Yeah. You get me? So for that matter, I would come down that if you are experiencing stress, you should not take it lightly. You should take steps to help, to distress, to help yourself.
Yeah. What are the steps to take?
Well, first and foremost, you need to know the triggers and try to avoid them. And when it becomes, for me, because if you do not have that appropriate knowledge, seek for help. Yeah. That is what I advise. You may take some steps that may not be helpful to you. Yeah. Some will enjoy drinking alcohol and taking substance. And they all end up on the street. Yeah. So if you are not sure, take steps. But there are simple lifestyles.
But what are the triggers? At what point would you think that I am stressed and so I need help?
Well, when more often when your mental capacity, you know that your mental capacity have dropped. You cannot sleep well, you cannot eat well, you become restless. Things that you used to enjoy, you are not enjoying it anymore. You cannot relate well with your colleagues. Yeah. You understand? Your work capacity, you know that you can read continuously for 3 hours. Now you realize that now you can 1 hour, you get tired and that sort of thing. Yeah. Mental exhaustion. The moment you begin to experience this thing, it should tell you that, look, you need some sort of help. And there are basic lifestyle changes that you need to sleep well, you need to eat well. You don't spend the whole night looking at everybody's status and responding to it when you need to be sleeping. Yeah. If you don't get good sleep, it affects your mental capacity. You get tired all the time. So these are
as well.
So basic lifestyle changes, that is the first step. But when it graduates, then you need to seek for help.
I want to talk about how to foster the culture of acceptance. I mean, understanding people having mental challenges and then, having some empathy for them. But it brings back the conversation about awareness. You talked about COVID. Even COVID, that affected everybody. We were all scared. This is new. I mean, it's going to kill us. And so we all wanted to read something about it. But you want a third party to have empathy, to feel for someone close to them and not to stigmatize them. They are 2 different things. So I want to believe that there should be a systematic way of actually imposing all of these on us, creating that kind of awareness. That also works. Instead of waiting for us to get up and go start reading about how to, get the triggers. If you have a colleague or a family member who is showing signs, what are the signs they will be showing? What should I do? How about you imposing it on us?
Imposing knowledge is quite difficult here. But what we need to understand is that each of us is at risk at any point in time of experiencing mental health problems. Yeah. And for that matter, how you want to be treated when you experience it, you should so in the same way extend that treatment to, that is the basic thing. That is the basic thing.
Whichever way you look at it,
Whichever,
there must be some form of education.
There must be some form of education. That is when this opportunity came. I'm here.
Yeah.
You understand? So I congratulate you guys for doing what you do when it comes to mental health. Others are doing. But you need, as an individual, to arm yourself. That is the first thing. Whilst because awareness, it takes a lot of money. You know that.
Yeah.
We have our financial issues. Government is doing so much to support us, but everybody's asking for money. Everybody's asking for money. Okay. There's very little that they can do when it comes to that. So with the little resources that we have, we are doing that. You understand? We go to schools to educate the students. We do virtual seminars that is open to everybody. We've trained a journalist to talk to people how to report on mental health issues, so that we would reduce the stigma about all this. So these are basic things. But if there is more resources, we could do more. If you decide that, mental health authority, every week we are giving you 5 hours to come and do education, we could. There are so many things that we could do with that. But of course, you're also doing your business, so you need to look at that aspect.
Well, it's a social intervention. Why not? Have you even tried that kind of conversation? I think it's something that we'll be interested in because it's for a good cause for the country. But also, you keep on talking about early intervention and prevention measures. Tell me about it.
Well, you see, mental health problems does not go away by itself. You need that professional help.
Yeah.
And the earlier you seek for that professional help, the better. Because if you seek for it, outcomes for you are better. Recovery is faster. Every little support that comes into the management and treatment from family members is worthy. If you wait and it gets worse, you would have to live here to go and visit that individual. It's costly because you are living. But when it's early, that means that you need only to talk to that person, for example. Have you taken your medication? Have you done that? And that support helps in recovery faster. So the moment you realize that you have a problem and you seek for early intervention, the outcomes are much better and faster for you. If you wait, it will get worse. And as it gets worse, management and treatment becomes more expensive and more difficult.
And so if there is that intervention, early detection, or you find out that there's something like that, there's also what you call the personalized treatment.
Personalized treatment is when you've gone into the facility. You've gone into the facility.
Okay.
And the doctors and nurses, the doctors have assessed you and decide that this is the plan, that this is the management plan they are going to follow in your treatment. That is personalized. If we suffer...
Is there a possibility
of course, that is what they've been doing. That is what they've been doing. That
means that you don't have to be admitted at the
hospital. No. We are talking about community-based. So you go in. If you go in early, they don't. Perhaps they would not need to admit you. So they give you the advice, the medication, whatever it is. But we have community mental health nurses who would come home to have a look at you and help in the management. It's all management to treatment.
We've been talking about educating the public. We've been talking about how we ourselves can take up the mandate, upon ourselves to read and understand what the triggers are and act fast. But we need to also talk about health professionals, those who give care to mental health patients. What's our situation as a country?
Health professionals in general, or mental health professionals? Mental
health professionals, and in terms of their training?
In terms of their training, I would say they are having the best of training.
Okay.
The numbers that we have issues about, because you've reported before that most of them are living outside to seek for greener pastures. And so that has reduced the numbers, increasing the burden of those here. But the fastest strategy is to increase their production. Of course, not forgetting about the quality. The quality will not be compromised on the training that they will receive. But the idea is to increase production from the training colleges so that they would they would close the gap with this training, yes.
So generally, what would be your assessment of mental health care in Ghana? Has there been an improvement, or we are having more people on the street?
I think last year or so, the Minister of Health reported about 16,000 people on the street. That is a huge number, and that is concerning. So for me, even if there is one person on the street, that is too much numbers for me.
Yeah.
You understand? That is too much numbers for me.
Okay.
Mental health in Ghana, yes, there is more room for improvement, but we've done so much. Years ago, you guys will not even have mental health issues to talk about. But here, we are talking about mental health. So through that education and awareness and collaboration with you guys, that is one bit. The passing of the act in itself, we are trying to, our current chief executive is more enthused about collaboration, bringing everybody on board, because everybody is working in their silos. But if you all work together, the impact will be huge.
Yeah.
The impact will be huge. So that is what we are looking at. We are asking everybody that, look, if you are doing something about mental health, come, our doors are always open. Let's see how we can work better. So that asking me to come and negotiate for my 5 hours. Of course, we are going to start that when we finish this program. So that is all that we are looking at this stage.
Let's look at the challenges. I mean, funding is something we all know about. It's been one of your biggest challenges. What other challenges can you talk about? And has it gotten better in terms of funding?
Funding, I would say that, I mean, if we get more, we'll be happy with it.
Okay.
And we
Are you satisfied with what you have now?
I would not use, as far as if we get more, we'll be happy. If you are eating one
Oliver
cake,
Twist asked for more.
It's an issue of an Oliver Twist asked for more. So yes, we are grateful for any that government does for us. We are so much grateful because every little helps. You understand?
Okay.
Yes. So financial issues, yes, that's the major problem, because whatever you need in terms of medication, in terms of logistics and resources, even the producing the nurses, everything is money. You understand? And it's a system, but the money is what you need.
Yeah.
So if the money comes, all these things would be addressed. Yes, the challenges are there, but I must tell you that we are doing our best under the circumstance. And yes, the stigma is there, but I can say when you talk to people, are more receptive to listening to mental health issues than previously. So that means that we've made some impact. We've made some significant impact. People embracing mental health. Attitude, stigma, it's quite deep. So it takes quite some time to uproot it, if you understand what I mean.
Yeah.
But at least we've made quite significant progress.
Well, this is an issue that we are all interested. We will support you all the way as you try to improve on mental health care in the country. We wish you all the best, and thank you for the good work. Dr. Yaramankwa Arthur, he's the Deputy Director in charge of health promotion at the Mental Health Authority, and we've been talking about how to improve on mental health care. Let's get on.